all of those who are attending and watching this webinar on Medicare, an incredibly important subject and topic. Thank you to Carmen for joining us, and I'm going to kick this off to her shortly. For those of you who are on and you do at all want to pop in questions, feel free to use the chat to do that or do a raise hand function. I will keep an eye on that. Otherwise, please just kind of sit back and enjoy all the information that is going to be given to you from Carmen on this little talk on Medicare. I am recording this, so any of you who want this afterwards or need a refresher, I will be sending this out to everyone who did sign up. So you'll be able to go back to this on a regular basis if you have any questions. And I will share Carmen's PowerPoint with you as well. So if there's any resources, etc., in there, you can always use all of those. So I will kick it right over to Carmen.
So good afternoon, everyone. My name is Carmen Cisneros. I work for KaiserPermanente, but today we're going to be talking about the Medicare 101. So this affects everybody that is Medicare eligible, whether you're 65 and older, or if you're under, is maybe because you are a disability. So this is for everybody that's on Medicare, not just for those who are on KaiserPermanente Medicare. So let's kick this off. Okay, next. So here is our agenda today. So first of all, we're going to talk about a quick Medicare 101. Oh, I just got out.
I can still see and hear you, Carmen.
I cannot see you.
Oh, shoot.
I'm gonna.
All right, you are back. Can you hear me?
Perfect.
Okay, you're back.
I'm back. Okay,
Okay.
perfect. So I'm not sure what happened. So first of all, we're going to go over a Medicare overview. So this is our agenda, and then we're going to move on to what we call is a Medicare supplement. There's different ways for everybody to get their Medicare. And then we're going to move on to a prescription drug coverage. What does that look like for 2026? And then we're also going to talk about Medicare and Medicaid, how it affects those who are dual eligible. And lastly, we're going to talk about open enrollment periods. So that's super important to know when you can enroll and how you can enroll. And then at the end, I will have Q&A. So stand by, write down your questions, and at the end of the presentation, I will be taking your questions. So let's talk about who's eligible for Medicare. So you got to be 65 or older. If you're under 65, there's other qualifying conditions that automatically qualify you for Medicare. So if you have ALS or end-stage renal disease or another disability, but when it comes to a disability, you have a 2-year waiting period. On the 2 year and 1 month is when you automatically become eligible for Medicare. And also if you have railroad benefits, so you automatically become eligible at 65. Next. So let's talk about Medicare. Let's talk about the ABCs. So Medicare has a lot of, Medicare was established in 1965. It is federally funded and administered by CMS. Medicare has a couple of different parts to it. So first and foremost, there's a Medicare Part A, which is your hospital coverage. I will nod my head to make sure you know to click OK. So Part A is going to be your hospital coverage. Medicare Part B is going to be your medical coverage. Think about everything inside what's inside the hospital. And that is what we call your original Medicare. So that's Medicare Part A and B. And then also, you need to have a prescription drug coverage in order to cover you for your prescriptions when you're Medicare eligible. And if you have all these parts, the Medicare Part A, B, and D, you actually have what we call Medicare Advantage plan is one complete plan. Next. So let's take a deep dive into what Medicare Part A is. So Medicare Part A, for those people who are who worked 10 years, are entitled to that at no cost. What it covers you for is your inpatient, nursing, hospice, home health. So again, it is for those who worked for 10 years and paid into it, a minimum of 10 years or 40 quarters, you are entitled to that at no cost. Next. If you did not work 10 years and you were a stay-home mom or a dad, and you have an eligible spouse, you may borrow his or her quarters. If you do not have that, then you may be paying for that Medicare Part A. That Part A can cost you up to $500 and some dollars. If you worked 10 years, you are entitled to that at no cost, and which is what we call premium free. The Medicare Part B, everybody has to pay for that. Okay, so what the Medicare Part B is, what that covers you is your preventative care, your outpatient, your doctor visits, your dialysis, and your durable medical equipment. So durable medical equipment, that's like your oxygen and CPAP machines, okay? So what happens is there's different ways that Medicare Part B gets paid. So next. That Medicare Part B, for those who are drawing Social Security benefits, it automatically comes out of your Social Security benefit. This year for 2026, or this following year for 2026, that's going to be $202 on average. For those who made more, who are high wage earners, you are imposed an IRMA and you get to pay more for that Medicare Part B. If you do not enroll when you're first eligible for that Medicare Part B, so let's say you're eligible right now and you don't enroll right now and you wait till 1 year, you get assessed a penalty. That penalty is 10%, and that penalty is assessed year after year, and it's a lifetime penalty. So it's very important to enroll when you're first eligible. Next. Okay, those charges are a lifetime penalty. Next. And those, you do not have to go on to Medicare Part B unless unless you are covered by an employer. Then you can delay Medicare Part B until you are ready. Go ahead and go through all of the slides next. Perfect. So when it comes to Medicare A and B, that is what we call original Medicare. Medicare pays 80%, you pay 20%. If you have a Medigap, Medigap can pay that 20% depending on which one that you would choose. If you have what we call the Medicare Part C, that 20% gets eliminated and you have predictable copays. Next. We don't have those Medicare cost plans, but here in Colorado. Next. So let's take a deep dive on what a Medicare Advantage plan is. So a Medicare Advantage plan is, think about a C It combines all parts of Medicare. So it combines the Medicare Part A, which is your hospital coverage, the Medicare Part B, which is your medical, and automatically most of those Medicare Advantage plans will give you a D, a prescription drug plan. You do have a network of providers that you have to go to with predictable copays. Next. These are the different types of Medicare Advantage plans. So there's an HMO, there's an HMO POS, there's a PPO, P for private fee for service, and a Medicare savings account. If you are wanted to take a deeper dive on what all of those are and the networks are, please give me a call because they all have different copays, different networks, and the way that they work are very different. So let's talk about the in-network. What does it look like when you're in network? So everything that any and all services that are in this service, they are covered. You have predictable copays. Your copays could be $0 or you could have a small copay. So that is what it looks like when you're in the network. If you go outside of the network, you are responsible for 100% of your cost, unless it's an urgent or emergency. In that case, you are free to go to any urgent care or any emergency and seek the services that you want. Basically, if you're in an HMO and you use the network, most and all of your services will be covered. If you go outside of the network, you pay for outside of the network cost unless it's an emergency and an urgent care visit. So let's take a quick deep dive into what the difference is between a Medicare Advantage plan and original Medicare. So with original Medicare, you do have some flexibility to go to other doctors versus the Medicare Advantage plan, which is a network restricted plan. You may need referrals when it comes to a Medicare Advantage plan, and no referral is needed when it comes to just original Medicare. You do have to be careful because not all doctors or healthcare systems accept just original Medicare. Next. The out-of-pocket cost is very different as well too. When it comes to original Medicare, you are paying 20% of the Medicare approved amount. Your Medicare Part B, you still have to continue to pay your Medicare Part B premiums. Their out-of-pocket limit, there's none unless it is specified by the A and B. You can choose a Medigap plan to help mitigate some of that cost, and there are some deductibles. So when choosing a Medigap plan or staying with Medicare, know that the cost structure is very different than a Medicare Advantage, which is a Part C plan. So let's talk about what the C looks like in comparison. So your out-of-pocket cost, it varies on the service that you receive. Again, that Medicare Part B, regardless of which coverage that you choose, you still have to pay that Medicare Part B on top of the cost of the healthcare plan. There is a yearly limit, so there is a maximum out of pocket in which that's going to be your safety net. So knowing that number means that if you have a catastrophic year, you will not be paying no more than that for a calendar year. And also, when it comes to the network, all of your services are going to be covered. So it has to be medically necessary on both of them. It can't be a cosmetic. Prior authorizations for the most part, with an original Medicare, it is not needed. And depending on the Medicare Advantage plan, you may be needing a prior authorization. And also with the drug coverage, you will have to purchase that separately because original Medicare does not cover that. Most Medicare Advantage plans do have a prescription drug plan. For those who like to travel, okay, know that your original Medicare will not cover you if you travel outside of the country. When it comes to a Medicare Advantage plan, some of them do include foreign travel. Some include for emergency services. So be cautious when you're traveling outside of the country, whether you do or don't have coverage. So that was the Medicare overview. Now let's go into what we call the Medicare supplements or the Medigap. Okay. So go ahead and click all of them. So these are going to be your most popular plans, is what we call the Medigap G, C, D, F, and N. Okay. They all cover you for different services. One of the things that you should be aware of is, because here's where it makes a big difference. First and foremost, how much does it cost? Who's your carrier? Also, and then the Part B deductible and the excess charge. What does that look like to you? So what a Part D deductible is, you got to pay the deductible first, and then the plan pays the rest, and you pay the difference. The Part B excess charge is whatever Medicare doesn't cover, you have to pay for 2026 an excise tax. So on top of what you're paying for the medical services, you may be charged to 15% more of your medical cost. So let's move on to the prescription drug coverage. Okay. So when it comes to drug coverage, these are administered either through a private healthcare plan if you have just a prescription drug plan, or a Medicare Advantage plan that includes your Part D in it as well. Okay, so you do not get your Part D with Medicare. You have to sign up directly with a private healthcare plan. Okay, so for 2026, go ahead and click one more. So for 2026, this is what the Part D looks like, whether you are in a Medicare Advantage plan or a prescription drug plan. Okay, so this is the same regardless of the plan that you have. And what's going to be different between one prescription drug plan and another one is the cost of your drugs and the formulary. So that means the list of the drugs that you are allowed to have per your plan and the cost. Okay, so no, go back. Go back. Right there. Okay, so here's how it works. So at the beginning of the year, everybody's going to start off at the initial stage. Okay, during the initial stage is going to be cost sharing. So between you and the plan, you guys share the cost. Once you reach $2,100, then you automatically go into the catastrophic stage. Once you're in the catastrophic stage, and you pay $0 for the remainder of the year. So in a nutshell, your out-of-pocket between yours and your healthcare plan is $2,100 a calendar year. Next. For those who are low income, next. There is a program called Extra Help. you automatically, or you can apply through the Social Security. It is income based. It does help out with two things. First and foremost, the Medicare Part B cost, which for most people, that Medicare Part B is going to be $202.90. And then on top of that, it can help you for cost of your prescriptions. Next, 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 next. Thank you. So that is called low income subsidy. So if you qualify for the low income subsidy, like I mentioned earlier, some people automatically qualify. You will get a letter from the Social Security or Department of Human Services that you automatically qualify. If you receive a paper, if it's a colored paper, that means you are accepted into the low income subsidy program. You do have to apply under the Social Security or the state Medicaid office. Next. So that was your prescription drug plan. Now let's talk about Medicare and Medicaid. So again, Medicaid is a state and a federal program. They work together to help you, those who are limited, that have limited or a disability, limited income or resources. Okay. It is home and community based, meaning it only works if you are within that state and that zip code. Next. There are different types of Medicaid programs. One is also a long-term care. Next. And they do cover vision and some dental. Next. Next. So for those who are dual eligible, and not all Medicaid eligibility is the same. So if you are at the highest level, Medicare and Medicaid work together, and you have low to $0 out of pocket coming out. So it can take care of deductibles, the Medicare premium, other services, and for most people, they're out of pocket, which is their copays. And it does help pay that 20% that you would have been responsible for if you had just original Medicare A and B. Next. So enrollment period. So let's talk about enrollment period. So when you're first eligible for Medicare, okay, you have a 7th-month window. You have 3 months before your 65th birthday, the month of, and 3 months after. Next. You are automatically enrolled into Medicare if you are currently receiving Social Security benefits. So you'll get your Medicare 4 months prior to your 65th birthday. That way, on your 3rd month, 3 months before, you can apply for your Medicare, and it'll be effective on your 65th birth month. Okay, it doesn't start birthday, it starts birth month. Next. If you're not automatically enrolled in Social Security benefits, there are some steps that you will have to take into account. So first of all, you have to contact the Social Security. You could make a phone call, and you could schedule an appointment, and you apply with them in person. So they'll schedule you an appointment with 4 to 6 months. Can you go back? So you can contact the Social Security, or if you have an account, you can also apply there too. Next. So if you miss your eligibility period, so you did not enroll when you were first eligible, every year, the first quarter of the year, from January to March, you are entitled to what we call as a general enrollment period, meaning that is your time to enroll in Medicare Part A and B. And your coverage could begin the following month, could be February, March, or April. So that is your oops period. You did not enroll in Medicare when you're first eligible. So here's your second chance. Next. Okay. One more. Perfect. So for those who are still employed and are covered by your employer, next, you have what we call a special enrollment period. So you are finally ready to retire. So what you're going to do is a minimum of 3 months, you're going to apply for Social Security benefits if you wish to get those, and you're going to apply for the Medicare Part B. Okay, you're going to need a special form. If you can give me a call and I'll make sure to get that to you, or you can call the Social Security office and they will provide that for you. And if you lose employment, you are now eligible to get that Medicare Part B. So you are what we call in a special enrollment period. Next. Or if you have retired. Next. Once you've done that, you are now Medicare eligible, and you gotta make sure you open up your mail, because sometimes that Medicare Part B comes in and it looks like your spam mail. Because if you don't enroll when you're first eligible within that time frame, you have to wait until the next year. Next. So moving on, do we have any questions?
Sorry, let me take a look. I don't see any Q and A's or chats. I think we're good. Should I stop sharing, Carmen?
Yeah.
Or is there anything you want to go back to in the presentation?
No, not at this point.
I do have a question. It's just with the enrollment, and right in the beginning, you did mention the penalty. So is so the penalty is if you don't enroll, there is a penalty, and that is just, you always have that penalty. Even if you enroll at the right time, the next year?
So when you are assessed a penalty, that penalty is a lifetime penalty.
Okay.
So if you're assessed that penalty, not only is it a lifetime, it's also a monthly. So you got to pay month to month. So it's very important for those who are Medicare eligible to know their enrollment periods, whether they're going to continue to work or they're going to delay because they have credible coverage through their employer. So it's super important to know what their plans are moving forward.
Even if you have the employment coverage, should you just at least go in the 3 months ideally before your 65th and enroll?
I always recommend everybody, prior to the birth month, I always recommend everybody to come in and do just a consultation, just to make sure that your coverage with your employer is just as good, if not better, or if going on Medicare is going to be a better fit for you. I always caution everybody, when you're on an employer group plan, ask these questions. Am I covering a spouse? Because if you go on to Medicare, that affects your spouse. They may need to look for additional coverage. 1. 2, does your employer provide a group Medicare plan options? If that's the case, you may need to apply for the Medicare Part A and B, and many times through their employer or through the health plan that you're looking for. So there's a lot of different nuances when it comes to Medicare.
And so like when you say like the consultation, like consult obviously if you're still employed with your employer, but then consult with someone like you or go to your social security office. Like what, I mean, we can't send everybody to you, can we?
That is correct. So yes, that's actually a really good question. This is something that I deal with on a regular basis. It is nice to know what your neighbor, your cousin, your aunt, your uncle are doing and what the process is, but I am going to encourage everybody to go to a licensed professional. They know the ins, the outs, and the enrollment period. So you can contact me. I'm always going to give you a free consultation. I just wanted what's best for you, but always talk to a licensed professional.
So for folks, would they, I mean, how do you find a licensed professional? Do you Google it? What's like, how do you find someone who is a licensed professional?
That's actually another great question. So you can go to the SHIP, State Health Insurance Program. So SHIP has people, or you can like for those who are interested in Kaiser, they can just come into any clinic and say, I
Okay.
want to talk to the Medicare lady.
Okay. All right. That's great.
Or-
Okay.
yeah.
Fantastic.
And
Let's,
one of the
oh,
things
go
that I do
ahead.
One of the things I do recommend everybody doing is do your research at least 3 months prior because sometimes that Medicare approval can take up to 3 to 6 months.
Okay.
So it's not a one size fits all, and it's not easy. Sometimes people will get a letter for asking for additional information. So they want to verify, they want your birth certificate.
Mhm.
How
Okay.
many people still have their original birth certificates? If you don't, you're gonna have to dig it up because
Really?
if you win that birth certificate lottery, you have to provide that original.
Wow. Okay.